Inflammation is a process by which the body responds to something that either shouldn't be there or that irritates it. So for example, if you get a cut on your arm, it's going to get red, swollen, and puffy, and then the body reacts, and over time, it heals and gets better. Inflammation is important in the body because it's the body's way of defending itself and of keeping itself healthy. People with CF have a problem with inflammation because the lungs in people with CF are full of mucus. People then inhale bacteria that get stuck in the lungs. They are unable to cough that bacteria out, and so the body responds with inflammation, and it constantly tries to fight the bacteria, and as a result, causes damage to the lungs over time. Inflammation is complicated, and we've really been trying to study it in cystic fibrosis for a long time. It's difficult because you need inflammation to protect your body, but too much can cause damage, so it's trying to find that balance, which makes it complicated. So there are two main approaches that we're using to tackle inflammation in cystic fibrosis. So the first is trying to prevent the inflammatory process from starting in the first place. So in response to a bacteria, we make inflammation. What the anti-inflammatory medicine would do would stop that process from even starting. So the other approach to treating inflammation in CF is trying to speed up the process so that it ends quicker. So once the inflammatory process starts, the body has a way of turning it off when it's done. So this type of medication or anti-inflammatory would help speed that process along so that it ends quicker before lung damage can start. So these anti-inflammatories would make a really big difference in people with cystic fibrosis. So unlike CFTR modulating medications, which may have an immediate impact and patients may feel better in as shorter as 4 weeks, anti-inflammatories may take a little bit longer before an effect is seen. However, these anti-inflammatory medications can stabilize lung function and decrease pulmonary exacerbations, which over time can keep people with CF much healthier and live longer.